And good morning, everybody. Welcome to the Board of County Commissioners Agenda Setting and Work Session for June 2nd, 2020. I am John Hutchings, the chair of the board, and also present is Vice Chair Commissioner Ty Menser, County Manager Ramiro Chavez, and I see on the screen Emergency Management Services Director Kurt Harden. I do not know who else is on the screen or on the phone. Am I missing people, Ramiro? I imagine I am.
You have Elizabeth Petridge, Kelly Murdo, Larry Schaffner, and
Gretchen
Marsha, Gretchen Thaler and Marsha Boyd.
Oh, very nice.
And hopefully Dr. Yu will join us here in a minute.
Okay. And for the public that doesn't have internet, if you'd like, you can dial 360-252-9020 to join the conference call. And your PIN number is 1234. And you can participate by listening, but not by discussion. So with that, I'd like to start with the COVID-19 update. Go ahead.
Commissioner, we're hoping to have
Dr. Everybody froze on my screen.
Come again. I'm sorry. You're freezing up. Are you okay?
Everybody froze on my screen.
Your screen is the only one who's freezing up here, but yeah.
Okay, so go ahead and who's going to do the update? Is it
Dr. Yu is going to do the update, and she just joined us.
Good morning, Doctor. Thank you for joining us this morning.
Shelley has taken a couple of days of well-deserved break.
Good, very good. All right, Doctor, you have it.
We're trying very, very hard to not disturb her, but I don't think we're succeeding very well. So, good morning, everybody. Is it time for me?
Yes.
Mm-hmm.
Okay, since I don't usually give these updates, it may not sound exactly like what Shelley gives to you. And it's interesting as I look up all of our numbers, it depends on where you look, and the numbers are a little bit different. So I'm going to give you what we have on our books for the numbers based on our weekly report. Total number of cases as of the end.
Oh, you are breaking up, Doctor. I'm sorry.
Okay. Sorry.
So go ahead with the numbers.
Total number of cases we have currently is actually 155 cases, of which 130 people have recovered or are recovering. We have had a total of 20 people who have ever been hospitalized during, this is all since March 11th. We currently have 2 people remaining in the hospital. We have 2 congregate care outbreaks. That is it. In Washington State, there's been a total of 21,977 cases confirmed, hospitalizations 3,517, and deaths 1,124. The total number of tests conducted in Washington State is 365,272 with a positive rate of 6%. In Thurston County, we've done, up until Sunday, we've done 9,339 tests with the rate of 1.6% positive. Our percentage positive has been staying at around 2%, plus or minus a few. When I look at the trend for the whole state, the testing has increased in the month of May. And that is true also for Thurston County. As you know, we have the outbreak that we're dealing with in 2 long-term care facilities. Do you want me to go into that right now?
Sure. Okay, sure. Since you mentioned it, people are going to want to know.
Yeah, we have a larger long-term care facility that serves independent living and assisted living folks. We became aware of a positive resident, I think it was on Tuesday, and became aware of a positive staff member on Wednesday. So that two unrelated individuals in one facility ends up defining an outbreak in a long-term care facility. So we made the decision to go in and do a testing of all the staff and residents and do the screening conducted by the health department. A total of 202 tests were done over a 2-day period. Of those 202 tests, we received 183 negative results. And there were 4 samples that could not be tested. And we received 15 positive results. There were 2, the staff member and the original resident, that were tested prior. So that makes it 17 total. And there were 2 other staff members that went to their own provider to get tested. So the total number of folks involved in this outbreak is 19. Of the 19, 11 were staff members and 8 were residents. So we've done a preliminary investigation. We've talked to the facility about infection control and have put a number of, it's probably a very long list of things that they need to do in order to keep everybody safe. So all the staff that are positive are on isolation at home. They are not working. All the residents that have tested positive are isolated in the facility. Because of the number of people who have turned positive, we will be going back. We ended up scheduling it for next Monday to do a second round of testing for all the negative to catch all the people who are positive. Because of the incubation period from exposure to getting for the test to show positive is anywhere from 2 to 14 days. And so we wanted to try to get as many. And there were, even though majority of the people who were sick stopped working on Thursday, a few of them who were not symptomatic were still working on Saturday when we got the results. And then at that time, they were asked to go home. So in addition to this one outbreak, and in this larger facility, the Department of Social and Health Services long-term care program is the regulatory agency for long-term care facilities. Local public health, our role is to go in and start the investigation and put in infection control measures and try to figure out how did it happen, and put in the measures to make sure we control the outbreak and have it not spread further in the facility as well as to the community. We've also asked the Department of Healthcare Associated Infections Unit to assist in giving them guidance. So they have been on the phone with the facility and will be coming to do a walkthrough on Thursday. DSHS has been involved with the facility since Saturday. So of the 19 folks, not everybody has symptoms. And there is one person who is hospitalized. Do you have any questions about the outbreak in the big facility?
Well, I have just real quick 2 questions. Number one, for Thurston County, we're at 155, and is it 1 death still?
That is correct. Even though if you look at the Department of Health numbers, it lists us as 2 deaths, but I will explain that in a minute.
Okay. And then my question before I get to you, Ty, if you have any, is regarding the long-term care facility. Department of Health and Social Services is the regulatory agency over those facilities. Do they see any potential change or a flaw in their managing the healthcare system that caused this or could have prevented it?
We have not debriefed with the Department of Social and Health Services. So, they take care of we have as part of our investigation, looking at possibilities of how did the infection come in. And when we investigated this and put it down, the timing is such that there was not really one person came in and infected everybody. There was not one that we could identify because almost everybody had the symptoms at around the same time, and or within 1 or 2 days of each other. So my suspicion, and all it is a suspicion, and this is why we asked the healthcare, the Department of Health to come and help us with this as well. My suspicion is that the initial exposure was to somebody who was not symptomatic. And that's how it kind of silently spreads. And among the staff, there were, identified, a lot of times we've seen this in other facilities. Healthcare workers do a really, really good job of wearing their protective equipment and doing all of that when they're with patients. But then when they're together, they tend to let their guard down a little bit. And they may not be socially distant. They may take off their masks. They may take breaks together. They may socialize outside of the facility. They may socialize with each other or with other people. So the fact that more staff, because I think the infection rate among the staff was 15.5%. That was a lot higher than the residents' infection rate was 5.8%.
Okay. Commissioner Menser, any questions of the doctor?
Nope, I think she covered it. Thanks.
Okay, thank you, doctor.
So we did have a second long-term care facility that also had an outbreak. One staff person, the first one that we identified, also worked in another smaller adult family home where there were 4 residents. That staff member was positive. One of the residents tested positive. So again, 2 unrelated defines an outbreak. So we had a second outbreak in a smaller long-term care facility. Subsequently, one of the, as we went and investigated, they had a different person working at the adult family home at the time we investigated. That person ended up being tested and tested positive. So there are 3 positives associated with the other long-term care facility. The other residents tested negative. And this is the discrepancy in our number and the department number. The person, the resident that tested positive was terminally ill on hospice and was expected to pass away imminently. He happened to get the COVID, and he did pass away. But the doctor did not believe that COVID was related to his death. So, but the way we enter the data, when somebody with COVID passes away, we check a box that says they passed away, and it automatically uploads the number. So the Department of Health is actually changing this system so that they are going back in and removing the deaths that are not related to COVID to get a more accurate representation. So our numbers show that we have 1 death related to COVID, and the Department of Health number shows 2. But that is not, and the Department of Health ultimately has the decision-making authority So they may rule that, yes, it was COVID related, or no, it wasn't. But as it is, we're kind of leaving it the way it is, and it's a little bit different. So,
That makes sense to me.
all right. The only other thing, and I'm going to go ahead and bring it up because I think it's a big elephant in the room. It's that we received guidance last night on what it would take for county and the rest of the state to move from one phase to the other. So because we entered phase 2 last week, we are eligible to apply to move to phase 3 on June 17th. They keep track of our numbers of our cases every day. So they have a running tally of the last 14 days. So the last tally that they had, we were at 8 per 100,000. And that was when we were supposed to have no more than 10 per 100,000. So the new, for moving into phase 3, that number has changed, and the number is less than 25 per 100,000 over the previous 14 days. So in that the number of cases, the case counts remain flat or is decreasing. And then a lot of the same categories, hospital capacity, being able to test, being able to investigate. And the one thing that we had no problems with before was we didn't have any long-term care outbreaks. We are supposed to not have more than 2. Well, for a county our size, the number of long-term care outbreaks that we have to meet is 2. So, so we're kind of keeping track on everything. I think it's a good time. I really want to emphasize that this is exactly what I'm afraid of, is that everybody feels like, oh, we're in phase 2. People from Pierce County and King County are coming down here to get their haircut. They're coming down here to eat in our restaurants. But I really want to emphasize that we all need to continue to follow the social distancing, wearing our face covering to try to keep each other from getting sick. And because at any time, somebody can have COVID and pass it on. And when we look at the nursing home outbreak, a lot of members in our community are saying, oh, well, they're all related to the nursing home. But those 11 people who are staff members live and work in our community. They are not residents of the nursing home. So they are out in our community. So at some point, somebody gave it to them. I am concerned that as we continue on and people get really cavalier about, oh, we don't need to wear a mask because we have had no cases. Well, that was great for 7 days. And we've had, I think it was 22 or 23 cases since then. The other thing that's happening right now is all the protests, and people are out since we moved into phase 2 last week. People are out gathering in large groups, and there's going to be exposure. There's going to be more cases that we're going to see in the next couple of weeks. We have the capacity to test, but my job is to prevent the disease. I don't want anyone to get it because there are consequences to being sick with COVID, whether you're young or old. You may not end up being hospitalized, but getting the disease is not something you want to get. So I think everybody needs to do their best to be responsible and to help prevent the disease spread in our community. So I'm going to get off my soapbox.
Okay. Commissioner Mensah, any further questions?
I guess just a comment on that last part. I know that I would like to see our county, reopen it as fast as possible, but only if it's safe to do so. And the more I've been reading in recent weeks, the constantly changing information or knowledge and understanding seems to show the rising importance or understanding of the importance of the face covering and masking. So I appreciate the leadership that you showed on that, Dr. Yu, because I think that if people will take that part of it really seriously, we are going to get to a place where we can reopen more quickly, which will help everyone in any number of ways. I am concerned about, kind of the phase 2 mentality, if you want to put it that way. So I think that kind of pairing the reopening on some activities, but with continuing to maintain the masking and the continuing messaging is really, really important so that we guide ourselves through this appropriately and absolutely as fast as we possibly can safely. That's my goal.
Commissioner Edwards, any
Yes,
questions of the doc?
I do. Dr. Yu, how many of those last 23 were really, showed symptoms? I guess how many were asymptomatic? How many had symptoms, and did any of them need to be hospitalized?
One person was hospitalized, and I have to go back. There were at least 2 staff members that were not symptomatic, and with the residents in the long-term care facility, unfortunately, it's very difficult to. A lot of folks suffered from dementia, and trying to interview and get a symptom history was very difficult. And a lot of folks, when they hit that age, tend to every morning. So we did not assign symptomatic versus non-symptomatic for the residents. For the staff, we had 7 out of the 11 had said they had some symptoms, but not, they didn't have a fever, they didn't have a cough, but they had some body aches, they had maybe a fever, a low-grade, felt feverish the day before, so milder symptoms. There was only 2 that had cough.
Okay, I'm just wondering, as we open up different organizations and locations are taking temperature and that type of thing, I'm just wondering how many, if that's one of the criteria used, how many are gonna walk through that door even though their temperature is taken? That's kind of where I was coming from.
Yeah, so I'm not a big fan of temperature taking. I think that you can take somebody's temperature, and you can obviously exclude people that have a fever. And some people may not be aware. Some people are very aware of their body temperature and know when their temperature is up. But fever is not the only presentation, and everybody experiences, as we learn more, everybody experiences symptoms a little bit differently. And the beginning symptoms is usually not the high fever. We do notice that with the elderly. That's oftentimes how you identify that a resident is sick, is they run a fever. But for other folks, the younger folks especially, we're not seeing fever as the number one.
Okay.
That is why the social distancing and the hand hygiene and keeping the face covering on is so important, because no matter at any one time, you can walk in and Commissioner, and I used you as an example in our discussion one day. You could walk in and be completely fine, and then tomorrow start running a fever. Well, you're infectious for 2 days before you start getting sick.
Okay.
So at any time, anybody, even if we screen them and they pass screening, could still come down the next day with symptoms. And so that's why the social distancing, keeping the mask on, making sure you wash your hands is just so important.
Thank you.
Go ahead, Commissioner Menzer.
Doctor, you had a follow-up, thinking about what you said about the criteria for phase 3, and that we can have, like, a county of our size should have only 2 outbreaks at a long-term care facility. Is that over what period of time? I mean, if we had a third, what does that mean? Is it?
So it's over the same 2-week period. So,
Same 2-week period. Okay, perfect.
so because the date is the 17th, what we've had that wouldn't count unless they have us count, from June 1st or whatever. But we know what we're experiencing. We can handle it. We can take care of it. The thing is, we want to do a better job to prevent the outbreak. And up until recently, we've done an excellent job. Our long-term care facilities have been doing a very, very good job of keeping outbreaks under control. And we have a Zoom meeting with the long-term care facilities today, where we're going to be discussing there is a mandate, an order from the Secretary of Health that all long-term care facilities have to test their staff and residents over the next 2 weeks. Initially, without an outbreak, my concern was that when we do that, we might find positives. And now with my experience in this outbreak, well, if we find positives, so be it. Because if we find positives before they start infecting other people, I think it's important to be able to identify them and control an outbreak before it happens. So, and the provisions for going into phase 3 also comes with a provision that says, at any time, the Secretary of Health, in consultation with us, either we can ask for it or they can decide that we're backsliding, that things aren't in control, that there's outbreaks that's posing a threat to the community, and they may ask us to go back to an earlier phase. Or we can request that we do that. I honestly believe that we can, if we all are diligent about it, we can safely move through the phases. I want to do more with my life right now, but I'm also out there being careful every time because I don't want to get COVID. I don't want to give anybody COVID if I get it. I think we all have to have that mentality, and then we can go through the phases, because this is our new normal. We're just going to have to be like this for a while until the disease goes away or we have a vaccine that's effective and safe. It's just what we're going to have to do. We can't stay cooped up forever. So we're going to need to proceed and move along, but we need to do it safely. So, I mean, it's a constant, I feel like I'm a nagging mom, because it's a constant reminder. It's the same thing I say every time.
So I'd like to add to that, Duncan. You said you described the elephant in the room as being moving from phase 2 to phase 3, June 17. And I think the elephant in the room also is the mandatory masks, the directive you put out. And what I'd like to what I want to say is, number one, up front and at the end, I support your decision. I support your directive. And it clearly states in the directive that it's not being enforced, No one's going to go to jail. No one's going to be cited. No one's going to be stopped and detained. And the intent behind the directive is to educate, encourage, and persuade people to wear a mask publicly when they cannot ensure 6 foot social distancing, which makes sense. And there's exceptions to that rule, of course. So I was likening that to the child restraint in car seats. In the beginning, it's designed to save children and babies, and it was not enforceable for a while. There was an educate, persuade, encourage people, change their behavior to save them in crashes and collisions. And now it's it's a primary offense. The same thing with seatbelts, designed to save people's lives, change behavior, encourage, persuade, use your safety restraint device. It's going to protect you. It was not enforceable for quite some time, but then it became from a secondary to a primary offense. Same thing with cell phones and distracted driving, designed to protect people against themselves. It's not enforceable. Then it became a secondary offense. Now it's a primary offense because people are still not. Everybody sees people all the time on the phones, in the cars, and that's not going away. So your directive is designed to protect people against themselves and to protect others from themselves, and it's not enforceable. But this virus will go away, or there will be a vaccination. And so I don't think we need to move into, or will need to move into, enforcement. I think it's designed as it is to encourage, persuade, and educate people. Please do this. We want to not go from phase 2 back to phase 1. We want to move from and progress from phase 2 to phase 3. And we need to ensure that we're doing everything that we possibly can within our control and being socially responsible to make that happen. So I fully support your decision to issue that directive. The comments that I've been receiving is it's a taking away of freedom of the public. But when you have a directive put out there that's not enforceable, that has exceptions, that actually says educate, persuade, and encourage folks to do this, is trying to change behavior. And if somebody chooses not to wear a mask, guess the consequences, they may get COVID or pass it on, but they still have that choice. So it sounds dangerously close to freedom to me. So I don't think we're taking freedoms away. I am, as a member of the Board of Health, I support your decision to do that. So I want to just get that out there. Thank you very much for that. It's bold, and I'm bold enough to look like I'm overreacting. That's fine with me. Thank you, Doc. Any other questions or comments for Dr. Yu, Commissioner Edwards?
Yes, I guess following up on what the chair has just said, I guess it looks to me like regardless, we are going to at least some form of herd immunity is going to develop, it sounds like, at some point. Maybe not as needed or as quick as maybe it's needed, but if only one out of those last week needed hospitalization, I don't know how that breaks down to the general population, obviously, but I am very concerned about mission creep when government does decide. Those examples that you used about the seat belt, for an example, I disagree with what I call mission creep. I'm going to be very conscious of mission creep and our freedoms. We are not a communist country like over in Wuhan, China. When they started this whole business, pretty soon they were running around dragging people out of their apartments and throwing them in cages, basically, and hauling them away, all in the name of the health of the community. Well, I don't think I will ever get there. So I'm going to be ever vigilant. Yes, I do believe that we need to have certain health issues available to address this. But I don't want people to think for a minute that I'm not going to be very vigilant about mission creep. Hence my questions usually as we discuss this activity. So Yes, I'm glad that we're able to have these type of things like masks, but I think we need to explain it a little bit better so that I had people asking me, well, I don't want to put a mask on to go work in the yard. And, so we need to make sure we're diligent about getting the message out exactly where that means to wear a mask and such. And Dr. Yu, I believe you're getting a good message out, but we need to keep it up. But I would like folks to know that I'm ever vigilant about mission creep by the government. That's,
Well, thank you for that, because I am vigilant as well about mission creep and how far we go or need to go. But I'm hearing though that all three commissioners support, I'm not gonna put words in your mouth, support you, Doc, in your directive. Is that the case?
And I thank you for that.
Oh, hang on, Doctor. I'm asking the commissioner by seatmates. Do all three support Doctor in her?
oh, sure. We are looking for the health of the community, and I believe that Dr. Yu is very sincere in wanting to accomplish her mission of do no harm and make everything a benefit. The reality is, we probably aren't going to get there to that point where we're going to do absolute, where nobody, that we don't live in utopia. We're going to have to struggle through this. So I'm very conscious of mission creep, and I'd like my constituents to be very aware of that.
Okay, thank you, sir. Appreciate that. Dr. Yu, you have the final word.
I just had one comment on Commissioner Edwards using the word herd immunity. We are so fortunate that we have had very, very few people in Thurston County that have come down with COVID. So it is very unlikely that we will ever reach a point where we would have herd immunity. Because in order to have herd immunity, you would have to have about 80 to 85% of the folks in the community have it, like they did in Wuhan. So it's unlikely, but I thank you for your support, and I also worry about mission creep. And up until last Wednesday morning, as I told Ramiro before I made the decision, I had no intention of issuing any kind of masking directive, but I could see the writing on the wall with the move into phase 2 and the gatherings, and then we had a looming outbreak, and I just what we're experiencing this week has been really, really tough work for your staff that worked in public health all weekend long. And it's very disconcerting because we've worked so hard to prevent, and then all of a sudden, whoa, it's kind of blowing up. But it's a good wake-up call. It's a good wake-up call. Listen, folks, it's not gone. So thank you for your support, and I thank the community for their support and continuing to keep everybody safe.
Doctor, it's kind of, I'll let you go in a moment. I know you're hitting the end button, but it's ironic. Last Tuesday at the commissioners meeting, I had a constituent ask about making it mandatory mask wearing, and this is relative to businesses in the cities. They want it to be mandatory, that the county make it mandatory. And I brought it to the commission for discussion, and I started off with saying, I'm not advocating for it. I'm not advocating against it. It just merits good discussion from these policymakers as to whether we want to do that or not and where we stood. And the next day, I think it was Wednesday, your directive came out, which kind of caught me by surprise. But it was a policy statement, and again, I support it. But the timing of that was just very intriguing to me. So thank you very much, and you can hit end, leave the meeting now if you wish.
Thank you. Have a good rest of your meeting.
Thank you, ma'am.
Doctor.
Thank you, Doctor.
Next is homeless strategies, and we have Keely Adui. Keely, yay, Keely. Go ahead, Keely, introduce yourself, and you're off and running.
Great. Good morning, commissioners. My name is Keely Marino. I'm the Thurston County Homeless Prevention and Affordable Housing Coordinator. Just a few updates for you today. We were given an opportunity to make comments on a shelter program grant coming from the Department of Commerce. This was actually a grant that we started working on prior to COVID, where the governor was releasing extra funds to just increase shelter capacity, and then it kind of went to the wayside once we started addressing and responding to COVID. So that the grant has been re-released, and they're asking for comment on the grant that they hope to release officially in mid-June. So our office has been working closely with City of Olympia. Part of this grant, if you recall, back in January, required counties to work with their largest cities in order to get the biggest reward. For jurisdictions that choose to apply separately, they'll get a reduction in they won't get the full amount of monies that they could get. It's formulaic. And so the ways that the monies will be dispersed are either based on the number of new beds that you're creating or on population size. I'm not 100% clear on what formula they're going to use, but we're definitely going to be applying for those dollars to increase our shelter capacity here in Thurston County. We have made a number of comments, and those will be sent, I believe, today or by the 4th. Last week, I was able to sit on a panel for the Senior Housing Work Group, where we talked about best practices in serving elderly folks in our shelters and address some of the discrepancies in treatment that some elders have experienced in shelters. I think that what came out of that was really interesting is for many, many years, we didn't have many folks over the age of 65 in shelters. The average life expectancy of chronic adults living on the streets is 46 to 48. However, we're seeing a significant increase in elders coming into our shelter facilities. And so working with that work group to ensure that our elder folks that are experiencing homelessness are treated with kindness and best practices. Our office is meeting one-on-one with all of our agencies that we fund, particularly through the 2163 document recording fee dollars. We're meeting one-on-one with agencies to just kind of do some future visioning of what does the homeless crisis response system look like moving forward, as we've been adjusting the way we do our programming to maintain social distance. And while some shelters have gone 24/7 that weren't 24/7 prior to COVID, and just really having a thorough deep dive discussion with each agency individually. And then we'll be workshopping those conversations both at the Housing Action Team and the Homeless Housing Hub meetings prior to the July HHSC meeting, where we'll be making recommendations for funding. Quarantine and isolation is still going pretty well. We don't currently have anyone staying at our quarantine and isolation facility. However, we have been working out some of the kinks, and we've been providing trainings. Myself and Meg Martin of Interfaith Works provided a training on trauma-informed care and harm reduction yesterday to both public health staff and Medic One staff. Those folks who will be staffing the facility when we have individuals that are placed there, which we might see an increase as we're also going to do weekly testing for at least the next month down at Union Gospel Mission on Thursdays for individuals experiencing homelessness that would like to be tested, with the understanding that individuals that would like to be tested will be expected to go into quarantine and isolation at our facility. We started long-term planning for quarantine and isolation, and what does that look like as we move forward? And the facility that we're using is no longer an option. We're at the very beginning stages of that, so really trying to think outside the box and be as efficient and thoughtful as possible. And that's pretty much it.
Commissioner Edwards.
I guess I just want to clarify something. You said if they came in for testing, they'd have to realize they'd have to go into isolation. That, if they test positive, is the only case that would take place, right?
No. Once a person who is experiencing homelessness tests, they will go to quarantine to await the result of that test. So we've had 2 people who had been tested previously at these testing events that went to quarantine and isolation until they received their negative test. So just as if I were to go get tested, I would stay home and isolate until I received either a positive or negative test result.
Okay, I mean, I'm gonna have some concern with that, if that's the case. I mean, I don't understand why we would require any citizen when they test, you know, they get their test back or a couple days. I mean, in the meantime, if they've got symptoms, yes, but I don't see testing somebody that just comes in, wants to get tested and tell them to go into quarantine. I'm gonna have a problem with that.
I think at this point, we're only testing symptomatic individuals. We're not
Right.
testing.
Okay, well then that's the clarifying
Yeah.
piece that we need to have in there.
We don't have the capacity to have a mass testing.
Okay,
We're just testing symptomatic, so for the unsheltered individuals that Keely outlined, they were showing symptoms.
okay, that
So
clarifies.
over 9,000 people.
And also, it's not, they can decide not to be tested. In fact, a number of people were curious about being tested, and when they were told that, you know, were they to test, there'd be an expectation that they go to quarantine and isolation, and they can, it's optional. It's not, you know, it's not a forced issue. They can make that decision with full consent.
Okay. Commissioner Menser, do you have a question for Keely?
The last thing you said before you got the questions was something about a certain facility not being available to us any longer, and we have to think outside the box. I didn't catch what that was.
Oh, well, our current quarantine and isolation facility, we have extended our contract until mid-July, so we can use it then. But the idea is to find something that we can operate for up to a year.
Okay,
So we're just looking for something more permanent.
gotcha.
Okay, hang on, Gary. Keely, I have a question that is regarding the elders that are homeless. Did you say the typical lifespan is 48, 45, something like that for a homeless person? But you're
Correct.
seeing an increase in elders that are homeless. How are you defining elders? Is it 55, 60, 65? How old are you?
That's a really good question. We kind of we've had a couple conversations about this in our community, but typically over 60, 65, we're seeing, you know, a lot of folks that are experiencing chronic homelessness have end-of-life issues and need end-of-life care in their 40s, just due to the complexity of homelessness and how it compounds underlying medical issues. So yeah, I would say that 60s and up would be.
I know Denny's defines it as 55. So I didn't know. Thank you. Commissioner Edwards, go ahead, sir.
Keely, is there any more information out about, apparently the city of Olympia is talking about spending some millions of dollars for a homeless, I don't know, condo or something out on Martin Way. Is there anything new on that? And my interest is, we've got all those empty buildings in downtown Olympia. How come they don't convert one of those instead of spending millions of taxpayers' money? I mean, I don't know where they're at on it. I know they were having hearings, and I thought maybe you could brief us a little bit on that.
So I'm not aware of that particular project of City of Olympia looking at Martin Way and Carpenter Road. I haven't heard that in any of
No,
my.
it's not Martin Way Carpenter.
I think it's 2828 Martin Way up there
Yeah.
by Martin DeVoe.
It's over
so
near the bus maintenance building, I believe, somewhere in
Correct.
there.
Inner city.
The 2828
Inner-city
Martin Way,
transit.
yeah, was granted tax credit dollars, as well as was identified as a project to receive funding through our RFP process last year in 2019. So they also received home fund dollars through the City of Olympia. So they're being funded through state, county, and local monies to build a facility that would house people on the main floor in a shelter, and then have up to 60 units for permanent supportive housing up above. So that project has been ongoing for the last year or so. They plan to break ground in September, is what I understand, and is a combination. Its intent is to move the shelter that's that's currently being housed at Interfaith or at First Christian downtown into that facility, because the First Christian Church was never designed to be the permanent home of, upwards of 60 people in their basement. So the intent is to move that shelter that already exists into that new building that will start being constructed in 2021.
Thank you.
That's a good update on where the city is and where the funding came from. And Ramiro may have more from the city manager's perspective of what they do or don't do what they do. That's almost a different question at this point, though, from Olympia's policy perspective. Any other questions from Keely? No, Keely, thank you very kindly. Appreciate it.
Thank you very much.
And the June 2nd meeting is canceled. The BoCC is canceled. And so the week of June 9, we're going to get into reviewing.
Commissioner,
Yes, sir.
the board agreed to consider on a weekly basis canceling the formal Board of County Commissioners. So the June 2nd meeting, you made a decision last week, which is today. And the legislature, as well as the governor, extended the waiver for OPMA until June 17, and also put some restrictions as to how we can implement gatherings. So the question that I ask is, would you like to cancel the formal Board of County Commissioners for June 9th? And again, I'm just following on the weekly decision-making process of the board.
Well, I'll open up for discussion, but my thing is cancel it up through June 16th. But I'll have the commissioners weigh in. If you still want to do it weekly, that's fine. Go ahead, Commissioner Edwards.
Yes, from my perspective, I would like to do it weekly, because if in fact we stick with this schedule that Dr. Yu talked about, the possibility that we might get to go into a phase 3 on the 17th, I would like to make sure that we're putting in and getting all of our paperwork ready so that we can actually submit. So maybe we can submit early and then get granted the ability to move into it by the 17th. And even though that's after our next meeting, I see the governor has changed the criteria now several times leading up to these different phase implementations. So I would still like to just do 1 week extension because I'm hoping we can get back to somewhat normal activity here in the courthouse and have us available to the public and to interact with the public sooner rather than later. So I'm opting just for a week.
Weekly, okay. Commissioner Menser?
I'm fine with going week to week if that's what Commissioner Edwards prefers.
It makes sense to me. There's, so we can still continue doing it weekly. So a thumbs up for canceling the 9th of June, next Tuesday.
Okay, thank you, commissioners.
All right, thank you. And the next Tuesday, we'll discuss the 16th, see where we are.
Right.
So in review, let me see. Oh, it's pretty short. The first one, number 1, is a bid award for a server cooling unit.
Yeah, for your consideration, commissioners, as you know, we depend so much on technology, even right now, even more so as we practicing a lot of telecommuting. And we have what we call server rooms. They need to be kept on a certain temperature in order to operate adequately and be reliable. And so this particular proposal is for you to consider awarding a contract to replace the air conditioner unit and associated components on the county server room by installing 8 high-efficiency 2.5 ton split system air conditioning units. Work includes refrigerant piping and refrigerant electrical controls and accessories. So on May 26, 2020, we received 4 bids. with the apparent low bidder being Capital Heating and Cooling Incorporated of Lacey, Washington. They provided a low bid of $94,190, and that did not include tax or contingency. So staff is asking for you to consider awarding the contract for a total of $113,348.25, which includes the base bid plus the sales tax as well as 10% contingency. And ask for you to also authorize the assistant county manager to go ahead and sign this particular contract. This is included on our budget. Project has been already in the works. And if you have any questions, Robin is here to answer any questions.
Commissioner Mensah, any questions?
So is this, what's the state of the current, I mean, is this gonna make it use less energy, or is it gonna add something that's not there, or is it gonna replace units that are on the brink of failure? What exactly is the scope or the status?
The current cooling units are on the brink of failure. We've had to go to extraordinary measures to keep the room cool enough to support the servers. So this will correct that problem.
Is that it?
I guess I have a follow-up question.
Go ahead, Gary.
When you talk about the server cooling unit, is that just for that one room in the basement?
Yes,
For just the one room?
it is for the server room. Large computer servers generate a lot of heat, and the room has to be kept cool so the servers don't fail. So there are special cooling units in that room for that reason.
Here's a further follow-up. In terms of, does our staff have the expertise to sort of decide what we needed or what kind of cooling? I mean, or did we have outside help on that to figure out that this is what we needed to keep the room appropriately cool?
So I think that our IT staff have that expertise, and they were closely involved with this project, but I'd need to defer to Dennis for that.
Is Dennis with us?
Not this morning.
Okay. And this is a precursor to next week, so perhaps we can get that information in the meantime.
Yeah, we'll follow up on that, commissioners.
Okay. Anything further, commissioners, on that one?
No, sir.
Okay. Number 2, setting a public hearing for the HUD annual action plan.
Yeah, for your consideration, commissioners, the Thurston County receives funding from the U.S. Department of Housing and Urban Development, also known as HUD, for home investment partnership programs, also known as HOME, the Community Development Block Grant Program, CDBG, to provide a variety of activities that serves the low-income households and individuals. This funding is contingent to a 5-year consolidated plan, which sets policies, directions for the county activities during the 5-year period. Thurston County adopted the 2018-2022 consolidated plan back in 2018. As a requirement for us to use the HUD money, we need to set a public hearing for the public to provide a perspective as to how those funds will be distributed. The amount of funds available for both the home and the CDBG is approximately $2,174,363. The City of Lacey has selected projects for the CDBG program. The Health and Human Services Council reviewed the applications of home funds received through the Thurston County request and proposal process. So, and the reason is you see Lacey program because this is the year in which the City of Lacey defines and distributed the CDBG dollars. As you may recall, the distribution of the CDBG dollars goes on a rotation basis. In 2020 is the City of Lacey, 2019 was Thurston County along with the South County cities, and in 2021 will be the City of Tumwater. The City of Olympia is not part of this rotation program because they have a direct allocation from CDBG because they're meeting a different threshold. And again, for your consideration is for you to set a public hearing for Tuesday, July 14, 2020 at 3 p.m. for you to receive public testimony related to the fiscal year 2020 U.S. Department of Housing and Urban Development Annual Action Plan. And I believe Tom and Jacinda are online. Would you like to have any questions about that? You're muted, Commissioner.
I don't know, I'm talking to somebody else.
Oh, sorry.
Commissioners, any? So is Tom going to give us more briefing on this?
If you have any questions, they're available.
Okay, go ahead, Tom. Anybody questions anybody of Tom or Jacinda?
I haven't seen this plan. Is this something that we need to be looking at, or is it just laying out the rotation that Ramiro described, or is there more detail that we're going to have to go through?
There will be more detail. The plan will be posted on June 11th. We're in the process of writing the plan right now, so we're setting the public hearing for July 14th. But there needs to be a 30-day public comment period, so the plan will be available for public comment beginning on June 11th.
Perfect. I haven't missed
We'll
anything.
provide that for your review.
I looked at that as June 14th, so that's good that July 14th, that gives me more time. Appreciate it.
Also,
Commissioner
Tom,
Edwards, any questions?
No, sir, not at this point.
also, Tom, can you describe in 2018, the board approved the 2018-2022 consolidated plan. Can you give a highlight as to what that plan includes as a high level?
Yeah, so that plan is it's a 5-year plan that lays out, it provides some background on kind of housing conditions in Thurston County, but it also lays out broad goals of how we want to spend our CDBG and home dollars. So it lays out affordable housing activities, public service activities, public facilities and infrastructure, and economic development is 4. There might be a 5th, but those are the 4 broad areas that we identified where we wanted to spend these funds. So it's a very broad plan. And then within each annual action plan, you identify the specific activities that you want to fund that fall under those categories of either affordable housing, public facilities or infrastructure, public services, or economic development.
Go ahead, Commissioner Edwards.
Tom, would the plan that you're developing, would it be very similar to the one that we have on file now if a citizen was interested in kind of the concept of
we
it?
do have the 2019. All these plans are available on our website, at the Public Health and Social Services website. So they are available. So the plan we passed last year for 2019 identified the specific activities for the South County for the CDBG that were funded last year. This plan will have a lot of similar information, but will identify the specific projects that Lacey identified, along with the 3 capital affordable housing projects funded under the HOME program.
So I think there may be a good clarification at this point. This is not intended to change the 2018-2022 consolidated plan.
That is correct.
This is the public hearing is for the public to provide testimony on projects on the action plan for 2020. And those projects are aligned to the overall plan that was already approved.
That is correct.
So I just want to make that difference. This public hearing is not to update the 2019-2022 consolidated plan.
That is correct, yes. And you will have an item later on where we're going to be amending. There's several public hearings that we're going to be setting, just to kind of give you a little preview, all for July 14th, because there's some additional funding from actions we need to take and have public hearings on. So we can discuss those as they come up, but just be prepared that we've got 3 public hearings that we're setting around our annual action plans. And I know that's going to be a little confusing. We're trying to do them all on July 14th. So we're just managing the HUD notification process, and all of these require public hearings for the public to weigh in and how these funds are spent.
Right.
Hey, Tom, thank you very much. Jacinda, thanks for checking in with us. Appreciate it.
Thank you.
And so that takes us to a reminder of virtual public hearing Tuesday, June 9, 2020.
Yeah, this is just no action for you commissioners. You already approved setting the public hearing for next Tuesday, June 9th, 2023 in the afternoon. And that's where you will be receiving public testimony related to the renewal of the interim emergency housing ordinance. And it was just a reminder.
Thank you. So proclamations and awards.
Wait, Commissioner?
Yeah, go ahead. Yeah.
I wonder if the county manager could explain, as we move into that hearing on June 9th, how the public is going to make comment, because we're probably not going to be open like we would normally be. So what's that process going to be?
So,
He'll explain that because we have a public hearing this afternoon.
but I can certainly explain that. We have a public hearing this afternoon.
Yes.
That's going to be the first ever, at least that I remember, is going to be a virtual public hearing. We have made available to the public a link to a Zoom meeting this afternoon, as well as we'll have the conference call available to whomever wants to join via telephone. Also, we have already opened up written testimony as the normal process. So how we're going to be managing this afternoon, it will be similar to what you see on the screen at this point. I will help Commissioner Hutchins to go name by name and ask if they want to provide public testimony, and we'll give in 3 minutes as we have done in the past. And also for those comments they will have received in written form, the staff will be reading out loud those comments that we have received. And also I will ask to whomever has joined via conference call to see if they want to participate and provide comments. That is how we're planning to manage, but we will learn.
Okay, I guess my concern is I don't think we're going to have a lot of interest probably at today's public hearing, and maybe that'll be a good way to get us through the process. But I just want the public to be aware that there is going to be a mechanism in place that they can actually sign up for their public comment.
Yeah,
That's
absolutely.
kind of the part of
And
it.
the news release includes that option.
Okay.
How they can get access. So we have informed the public and on the many different ways they can get access to this public hearing.
Thank you.
And again, I'm not here to say this is gonna go smoothly, but we'll do just about every single effort to make sure the public has access to provide you public testimony this afternoon.
Murphy's Law. And I'm glad you asked that, Commissioner Evers, because I've been working with the county manager on that process and how we will facilitate everybody having an option or an opportunity to weigh in on any of these public hearings as well. I want them to be assured of that. So with that, advisory boards and commissions?
Nothing pending for you, commissioners.
PIO check-in.
Good morning, Commissioner. Brian Dominique, Public Information Officer. I don't have a whole lot of updates, but I did want to respond to a request from Commissioner Edwards. I pulled our followership numbers for our social media platforms and our county news page, and I'll just provide those to you guys. So for Facebook, we have 9,869 followers right now. That is an increase of 2,017 followers from January 1. And then on Twitter, we have 6,165 followers. That is an increase of 522 from January 1st. And on Instagram, we have 1,681 followers, and that's an increase of 241. And then on YouTube, we have 415 subscribers, and that is an increase of 194. And then our county news page, which is the mechanism we use to send out our weekly newsletter and other news stories to the public. We have 439 subscribers, and that's an increase of 85 from January 1. So those are where those numbers stand right now. And I just wanted to respond to that.
Thank you.
Very good. Brian, I have a question that is regarding TCM. It seemed that anytime I would turn on channel 3, there'd be some type of a public meeting, either BoCC or one of the cities, or some commission meeting, like the port, whatnot. But it seems anymore I don't see that. So does TCM, do they take these meetings that we're doing now and do they put these on TCM as well to play out through the week or through the month?
No, I don't believe so. We can request that though. They can come in and record them. That's something we can do, but I don't think we're doing it now.
So the public has not seen on the local access channel any of our meetings for the last 2 months?
Yeah, I don't believe so.
Oh. Yeah, I'm not sure I like that.
I can get that fixed, Commissioner.
Yeah, let me hear from my seatmates. I just don't care. I'd like the public to see what's going on a regular basis. It's bad enough we have our doors closed. I'd hate to have the TV shut off too, where they can't see us when it's convenient for them. Commissioner Menser, anything?
No.
Okay. Commissioner Edwards regarding this?
I'm with you.
Yeah, I don't know how logistically they do it, but they're smarter than I am when it comes to this technological stuff. So if you can check on that, Brian, I'd be appreciative of that. And I'm surprised I didn't know that wasn't being done already for the last couple months. Okay, anything else for Brian? Nope. Okay, thank you, Brian, very much. And legislative update from Arrow.
I don't have any specific updates at this point, Commissioner.
Okay, then it's 10:10. I'll call it 10:10. We're going to take a 15-minute break before we get into our legislative role here now. And so we'll be back at 10:25. 10:25. We're in recess. Thank you. Welcome, TCM.
And we're live.
All right, welcome back to the June 2nd, 2020 Board of County Commissioners agenda setting work session. And we're going into the pending decisions now. And we'll start with number one, the auditor's office. And it's a resolution establishing a financial analyst position.
Yeah, Commissioners, this is back-to-back items, item number 1 and number 2 for you. And you have not reviewed those items in the past, but it's a sense of urgency. The auditor's office would like for you to consider actions today. The first action, it is for you to consider establishing a financial analyst, and that's creating a new position, but also abolishing a accounting assistant position. And the reason as it is that and Mary Hall is online. The auditor's office have taken an opportunity to see there's a retirement that just occurred. There's a very essential position related to their operations. And they have taken the opportunity to reassess what will be the best makeup of this position itself to meet the needs of the auditor's office in terms of financial services. And that is probably item number 1 for your consideration. Again, is creating a financial analyst and abolishing the existing position, which is the accounting analyst. This action results in an increase from $6,543. It increases to $7,214 a month. That will be a $671 increase or 9% increase on this particular action. But hold your questions on that because there's more to the story. And I'm gonna go to item number 2 because all that is part of the plan the auditor's office presented to you. So item number 2 is a reclassification from a position of accounting assistant 3 to an accounting assistant 2. And this particular action reduces the salary from $5,383 to $4,883 a month. That's a reduction of $500 or 11% decrease on that particular action on item number 2. Also, the auditor's office has been extremely, at least from my perspective, I have to give them credit because they have been very conscientious about the direction of the board that has taken in terms of, how we're going to be managing the different positions in here. So at this point, the auditor's office would like to move forward with in filling the financial analyst position, the item number 1. And the item number 2, which is reducing the classification from an accounting assistant 3 to an accounting assistant 2, they will keep that position open based on the direction they provided, that the board provided to have a cooling period for vacant positions for 3 months. So all this, in assuming the person who is going to take the financial analyst positions will begin at a lower step, right? So the auditor's office is assuming a totally savings on the general fund in 2020 of $21,860, and for 2021, $25,874. That is the overall package related to the items number 1 and number 2. And again, just to summarize, item number 1 is for you to consider creating a financial analyst position, and also in the same action to eliminate an accounting assistant analyst position. Action number 2 is to reclassify an accounting assistant 3 to an accounting assistant 2. Item number 1 will be filled right away, and item number 2 will remain vacant for a couple months. Any questions?
Auditor Mary Hall, do you have anything you want to add before we get to questions?
No, I think sort of explained it. I had a retirement Friday, Judy Ross, who'd been with us for 29 years. We had opened that as an internal promotion before the hiring freeze went on. So, we do have a candidate to step in. But, earlier in the year, we were actually planning to totally reorganize financial services. It's been the same structure for a long, long time. And of course, now we're not able to do that, but this is a tiny step. And we presented this plan to you also in our plan on the 22nd of March, our budget reduction plan. So, it's kind of a 1, 2, 3 step, moving a person into Judy's position, then the financial analyst position who will supervise AP, but reducing a 3 to a 2, which does give us and it's a time to do it because it's an open position. We're not demoting anyone. And we would keep that open, for the 3 months that you are requesting. So we will comply with that. But I want to reiterate how important accounts payable is, especially right now. We're on a buying frenzy with COVID, in front of us, and we're using grant money to do this. And this is a department that audits all of these expenditures to ensure that they have the proper documentation to ensure that we are going to get reimbursed with federal dollars for these positions. So, I just want to make it clear, keeping it open for longer than 3 months would be a real hardship, but we do understand your directive and we're willing to do that. But overall, we were trying to think outside the box when we were going through our budget cutting exercise. And this is one of them that we came up with. And it is, it's about a third of an FTE, over the long haul. And this will be a budget savings that will go on really for quite a long time.
Thank you, ma'am. Questions? Go ahead, Gary.
Is this what is the dollar impact to our current expense budget with this move?
So in 2020, we project it'll save $21,860.
Save.
In 2021, $25,874.
Okay, I want to commend you for that, but is this an example of an exception that we should, that 3-month business, I certainly don't want to impact your office's ability to do the job that's required. I know you've got some real crazy stuff coming up on election and what, so.
Yes, we do.
Is this something that you're obviously making the county taxpayers a savings in the end, maybe not in the long run, because we're all gonna, it's not like we're cutting anything, but it's a savings issue. And possibly, this might fall within that criteria that we would review as an exception, because you're probably not gonna get filled right away anyway, so maybe it'll take you a couple months no matter what you do. But I hate to hinder another elected office if we don't absolutely have to. So just a question, that's where I'm at.
I would surely appreciate that. And I think my folks in financial services would as well. My entire financial services division is spread pretty thin right now because many of them are working on various aspects of COVID, whether it be, working to make sure our procedures are efficient and that everybody is documenting correctly so we can get reimbursed for these funds, reviewing grant applications, et cetera. So I would certainly appreciate that, Commissioner.
I want to pass on that if that is the case and we're able to better track expenditures that will make us more eligible for reimbursement, I'm inclined to grant an exception on this particular issue. I'd like to hear from my seatmates about that.
I'm going to ask real quick, Robin, did you have anything to add? It looked like you might have.
Just wanted to speak in support of being able to make this change and go ahead and hire for these positions. Our finance positions are critical, as Mary said. We need to ensure that we have the proper separation of duties. We need her staff to do that. And as she said, many of her team are working together with the offices and departments that have COVID-related expenses and to ensure that we'll be able to collect those federal funds. So these are critical positions, and I just wanted to, I also support Commissioner Edwards' suggestion to exempt this from the hiring pause and let us go ahead and fill these finance positions.
Commissioner Menzer, questions or comments?
No, I support the two proposed actions. I guess my only hesitation on the second piece of it is just not knowing how many other, I haven't seen a list or how many other requests we're going to get. Robin and Ramiro have repeatedly told me over and over and over that we're going to get a lot of requests for variances and exceptions, and I just don't know what that looks like yet. But
Yeah,
I do understand the argument that's being made.
Yeah, I appreciate that, Commissioner. I had a long conversation with the auditor's office about this and for over a week. And certainly by June 12th is when you establish the deadline as to all the offices and departments will be providing their proposals. So this is a little bit of a one-off because I do believe the sense of urgency and the importance this position have on the operations. And that is why I also supportive this actions, the two actions, and that is why it's before you. I'm not attempting to bring what I call a piecemeal approach to you for considering similar actions in the future. But this certainly is an essential position as I see it.
Go ahead, Robin.
I'm behind the two proposed actions. I was talking about Commissioner Edwards' idea of exception to the pause for the hiring. That's the only part that I had a slight hesitation, even though I do understand the argument. But I'm fully in favor of the two proposed classification actions.
Go ahead, Robin.
So on the hiring pause, we can't give you a comprehensive list of what that's going to look like because we don't know what positions are going to become vacant. So those will always be on a case-by-case basis that we bring you as positions are vacant, and offices and departments will ask to go ahead with the recruitment process prior to the 3-month pause. And that's why this is just the first of those that you will see as positions become vacant in the future.
Go ahead, Mary.
And keep in mind, this is a result of a retirement, which are really hard to control. And, the risk we have with only having 2 people in accounts payable, if somebody is sick or has to, or they're on vacation, for example, I don't have that separation of duties. You can't audit your own work. And, that's why it's a department of 3. So and I don't really have people to borrow to put in there because everybody, I've got people working with elections trying to procure what we need to conduct our presidential election, finance folks. So they're spread very thin right now. And now more than ever with COVID, the auditing is critical, and I don't want them to be taking shortcuts on this. And it is going to take at least 90 days to fill this position. It's just not a quick process.
So Auditor Mary Hall and I spoke about a week and a half ago about this proposal. And after discussing with her, it made perfect sense to me that this would be the thing to support. And I fully support this. And to include the exemption if we're going to be doing that. So that's where I am. Anything further? Any other questions of Robin, Ramiro, or Mary Hall?
No, sir.
Okay. Is there a motion?
Move to approve the resolution establishing financial analyst position 02R01506 and abolishing an accounting analyst position of the incumbent in the Thurston County Pay and Classification Pay Plan.
Second.
It's been moved and seconded to approve a resolution establishing a financial analyst position and the rest of the motion. Any further discussion? Okay, all in favor say aye.
Aye.
Aye. That motion carries. And number 2.
I move to approve the resolution reclassifying position 02R000 7-0 from an accounting assistant 3 to an accounting assistant 2 in the Thurston County Pay and Classification Pay Plan.
Second.
It's been moved and seconded to approve a resolution reclassifying a position in the Thurston County Pay and Classification Pay Plan. Any further discussion on this topic? No? All in favor say aye.
Aye.
Aye. That motion carries. Thank you, Auditor. Thank you very much.
Thank you very much.
Do you want a motion regarding allowing this position to be filled immediately?
That would be helpful.
Yeah, why not? Sure.
I'll make a motion that we exempt the, I believe it's the accounting assistant 2 position from the hiring pause previously enacted by the Board of County Commissioners.
Second.
Been moved and seconded. Any further discussion?
Yes.
Go ahead.
This makes me a little nervous that all of us in the meeting are agreeing on everything about this. So without it being orchestrated ahead of time, that's what really makes me nervous. Okay, then I'm done.
All right.
I think it's evidence of the trust we have in our auditor.
Thank
And the
you.
need. All in favor say aye.
Aye.
Aye. Motion carries. Thank you.
Thank you very much.
You're welcome.
Appreciate it.
Thank you, Mary.
Number 3, public health.
Yeah,
I'll wait for Go ahead.
you reviewed this item last week, Commissioners, and this is also a request for reclassification from a, excuse me, from an education and outreach specialist 1 to an education and outreach program assistant. And again, Public Health has gone through the process to determine what will be the best fit on this. And this item was way before the Commissioners implemented this hire freeze, and also you took all the public health and social services out of this particular, what do you call that? Pause, hiring freeze. So this particular classification, again, goes from salary of the education and outreach specialist 1, which is $6,232, to $5,383. That's the top range for the education outreach program assistant, which is a total savings of $843 a month, or 13.52% a month. This particular position will provide support to the Nurse Family Partnership Program. And Gretchen Thaler is here to will answer any questions related to this item if you may have one.
Any questions of Gretchen?
No, sir.
Okay. All right, then Gretchen, do you have anything to add? If not, we're going to move on to a motion.
I move to approve the resolution reclassifying position 40R01402 from an education and outreach specialist 1 to an education and outreach program assistant in the Thurston County Pay and Classification Pay Plan.
Second.
It's been moved and seconded to approve reclassifying position 40R01402 in the Thurston County Pay and Classification Plan. Any further discussion?
No, sir.
No. All in favor say aye.
Aye.
Aye. That motion carries. Thank you, Gretchen.
Thank you very much.
Item number 4, lease extension with diverse properties.
Yeah, you reviewed this item last week, Commissioners, for your considerations to consider lease extension with diverse properties from August 1st, 2020 through August 31st, 2025. The Thurston County has a record center located at 2947 R.W. Johnson Boulevard in Tumwater. And there's approximately 10,000 square feet of office and warehouse space. The current lease expires on July 31st, 2020. The estimated total rent on an annual basis is $67,488. That will be just about $5,624 a month. The initial 12-month term with an annual increase of CPI of 3% thereafter. Also, there is an associated cost related to utilities, taxes, and insurance, which is an additional $52,771. So this is already included on the budget, and for your consideration is to approve continuing the lease of this program where we hold the Thurston County Record Center. And I believe Robin answered some questions you had last week, but she's available as well today.
Go ahead, Robin.
I have just a little bit of additional information that I got on this particular building. The county has been leasing this building since March of 1992. And apparently there had been a second lease of a second building for housing records. And in 2009, due to efforts to begin to digitize our records, they were able to consolidate into a single building and eliminate the lease on the second building. So we are working toward digital records. We continue to do that, but we do need the building that we're in right now.
Okay. Any questions of Robin or Romero? No? Okay, is there a motion?
I move to approve a lease extension with Diverse Properties LLC for Central Services Record Center use from August 1st, 2020 through July 31st, 2025 in the annual amount of $67,488 with annual increases of the CPI or 3%, whichever is lower, and authorize the Assistant County Manager to sign the lease.
Second?
It's been moved and seconded to approve the lease extension amendment with Diverse Properties. Any further discussion? No. All in favor say aye.
Aye.
Aye, that motion carries. And number 5, amendments to the Consolidated Homeless and Housing and Essential Needs Grant.
Yeah, you also reviewed this item last week, Commissioners. As a matter of background, on May 21st, 2019, the Board of County Commissioners approved affordable housing and homeless services contracts for 14 projects for a total of $487,977, which included many funding sources from the federal, state, and local funding sources. For the state funded contracts, Thurston County signed 2-year grant agreements with the Washington State Department of Commerce on June 30th, 2019. This contract provided for a total of $5,935,955 funding from the Consolidated Homeless Grant Program, also known as CHG, and from the Housing and Essential Needs, also known as the HEN, the HEN. The contract were awarded back in 2019 again. It went to nonprofit services agencies that provide essential services for persons experiencing homelessness in Thurston County, including funding for coordinated entry, rapid rehousing programs, as well as rental assistance. The list of contracts, for your consideration, request an additional funding for a total of $2,789,770. And those projects for your consideration will be as follows. For the Community Council Action, a total of $2,055,804. That will be, all of that comes from the HEN. That will be the Housing and Essential Needs Program. The next item is for Community Action Council again, but this is for the rapid rehousing efforts. And that will be an award of $249,922, and that comes from the Consolidated Homeless Grant, CHG. The next project is to award Family Support Center for the coordinated entry for $86,208, and that also comes from the Consolidated Homeless Grant. Last but not least, again for the Family Support Center for rapid rehousing for $397,836 from the Consolidated Homeless Grant. That will amount to the total $2,787,770. And again, this is the state funding money. Now, the Tom is available to answer any questions that you may have related to this item.
Any questions of Tom, commissioners?
Yes.
Go ahead, Gary.
This is all pass-through money, as far as I know, right?
That is correct, yes.
Was this the same fund that built the Coyote Village up in Tumwater, some years back? Was that, part of that?
I do not believe so. This funding is not used for capital projects, it's for services. So we use home dollars and some other fund sources for Coyote Village, but not from this source.
Okay, thank you.
All right, then is there a motion?
I move to approve amendments to consolidated homeless grants and housing and essential needs housing contracts between the county and two nonprofit organizations to fund 4 projects to add up to a total of $2,789,770 of funding and extend the period of performance for 1 year until June 30th, 2021. And authorize the Director of Public Health and Social Services to sign the contract amendments and additional amendments that do not change the approved dollar amount or duration by more than 10%.
Second?
We moved and seconded to approve the amendments of consolidated homeless and housing and essential needs grants. Any discussion, further discussion? No? All in favor say aye.
Aye.
Aye. That motion carries. Thank you. Thank you, Tom.
Thank you.
Number 6 is DSHS, long-term payable interlocal agreement.
This is for your consideration an amendment to the existing contract that we have with the State Department of Social and Health Services, DSHS. And this is related to the developmental disabilities, the DD program that we have in place. The state funds this particular program on a cost reimbursement basis. And what they give us is a certain advance amount for us to cover the programs that we provide under the DD, the Developmental Disabilities Program. Considering the circumstances, we could not be able to provide that. As you can imagine, so this particular contract amendment is to extend the existing agreement with the state through June 30th, 2021. That will give us an additional year because the existing contract ends on June 30th, 2020. So the dollar amount does not change. And the dollar amount that has been allocated to the county as a advance amount is $809,246. So it's more of a carryover type of request. And again, this is allow us to extend the contract so we can continue to provide those services in the upcoming year. So last week when you reviewed this item, there was a comment, perhaps the motion was not as clear. Hopefully with the revisions made, it's more clear, if that's the right word, for your consideration.
Questions or comments? None. Okay. Is there a motion?
Move to approve amendment number 1 to the State Department of Social and Health Services interlocal long-term payable agreement 1963-56891 to provide cost reimbursement for developmental disabilities program activities through June 30th, 2021, and authorize the Public Health and Social Services Department Director to sign the amendment and any future amendments that do not revise the contract amount or duration by more than 25%.
Second.
It's been moved and seconded to approve the DSHS long-term payable interlocal agreement. Any further discussion? Nope. All in favor say aye.
Aye.
Aye. That motion carries. Number 7, HHSC Council Basic Needs Contracts for 2020.
Yeah, thank you, Commissioners. The Health and Human Services Council, HHSC, which is comprised of 8 jurisdictions, including Thurston County, the cities of Olympia, Lacey, Tumwater, Tenino, right near in the town of Yokota. All they have signed an interlocal agreement, which is also known as the HHSC, to provide funding to local organizations that provide services to address unmet essential health and human services needs within Thurston County. in the Thurston County region. In February 2020, the HHSC established a basic needs priorities for the 2020 funding year and finalized the request for proposals, review process and criteria for the HHSC basic needs applications. Thurston County issued a request for proposals back in February 2020 to receive projects. We received a total of 15 applications for a single award contract. The total of that request was $700,216. The available funding is only $249,733. So the HHSC, which Commissioner Hutchins represents the board and that particular project, review all the applications and consider awarding 7 out of the 15. So the proposal before you is for you to consider awarding $70,000 to Catholic Community Services for the community kitchen, $21,000 for community youth services for CYS program support, $14,178 to Rochester Organization of Families, also known as ROOF, for emergency needs, $17,500 to Senior Services of South Sound for senior nutrition programs, $86,278 to Thurston County Food Bank for the Food Bank Collaborative, and $19,778 to the Thurston County Food Bank for other food bank hygiene and households. Also the last one, is for Together, Together organization for $21,000, which it will be for meeting the emergent and basic needs for the vulnerable and homeless students and the families. So that totals of $249,733.
Okay. And I'm going to guess Tom is available if you have any questions, commissioners.
Yes, yeah, he's available. Thank you.
Any commissioners have Tom for this? Nope. Okay, is there a motion?
I move to approve 7 contracts between Thurston County and 6 nonprofit service providers for a combined total maximum funding amount of $249,733 for the duration of July 1st, 2020 through June 30th, 2021, and authorize the Director of Public Health and Social Services to sign the contracts as well as future amendments, but do not change this approval dollar amount or duration by more than 10%.
Second.
So it's been moved and seconded to approve the 2020 Health and Human Services Council Basic Needs Contracts. Any further discussion? No? Okay, all in favor say aye.
Aye.
Aye, that motion carries. Thank you, Tom.
Thank you.
Number 8, setting a public hearing.
Yeah, Tom earlier mentioned to the board that perhaps there's going to be a series of public hearings related to the Housing and Urban Development HUD action plan. And this, for your proposal, is to consider setting a public hearing for July 14, 2020 at 3 in the afternoon to receive public testimony on amendments to the 2017 annual action plan of the HUD. Back in 2017, the Community Youth Services was awarded CDBG monies for $69,567 to for the replacement and transitional housing, rehabilitation programs in Lacey. Since that activity did not occur, the proposed fiscal year 2017 annual action plan is proposed to be amended to allow the deletion of these activities from the 2017 action plan and add a new activity for the same amount to the Community Youth Services to support increased emergency shelter operations in response to COVID-19. And again, it is a process that we need to go through when it's an amendment to the specific activities in which the money was allocated. This was in 2017. The program itself did not occur. And at this point, for your considerations to set a public hearing, we would receive public testimony awarding the same amount of $69,567 to the same organization, but to a different program, in this case related to the emergency shelter operations in response to COVID-19 at the Ross's Place in Heaven house. And again, Tom is here to answer any questions related to this proposal as well.
Okay, any questions? No? Okay. Is there a motion?
Move to set a public hearing for Tuesday, July 14, 2020 at 3 p.m. or as soon thereafter as the matter may be heard, to receive public comments and review amendments to the approved fiscal year 2017 annual action plan.
Second.
It's been moved and seconded to set a public hearing on an amendment to the approved fiscal year 2017 HUD annual action plan. Any further discussion? I would only add that perhaps July 14th, I don't know if we'll be in business with the doors open. That'd be kind of cool. So look forward to. So anyway, all in favor say aye.
Aye.
Aye, that motion carries. Again, thank you, Tom, for sticking around. Number 9, we're moving on to Storm and Surface Water Advisory Board.
Yeah, the next few items are related to appointments for your consideration. The first one is for you to appoint Ms. Jacqueline Simmons. She's a current member from the Surface Water Advisory Board. And the current position that she holds is an at-large position. And this particular request is to make that appointment as a District 2 member, which begins the term of June 1st, 2020 and expires July 9, 2022. And this particular item is related to the other 2 items on the Surface Water Advisory Committee. And I believe you discussed this on a couple of occasions.
Yeah, okay. And any questions? Nope. All right, motion?
I move to revise Jacqueline Simmons' current position in the at-large member to the open District 2 member of the Storm and Surface Water Advisory Board for the term of June 1st, 2020 and continuing through the end of the term, which expires July 9th, 2022.
Second.
It's been moved and seconded for a position change on the Storm and Surface Water Advisory Board. Any further discussion? All in favor say aye.
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 Aye, that motion carries. Thank you. And number 10.
I move to,
Sorry, number 11.
No, number 11.
So number 10 was the motion, so it's a typo on the agenda, I apologize.
Oh, got it.
Yeah. So the next appointment for your consideration under the number 11 on your agenda is for you to consider appointing Mr. Brett Netterhood to the Stormwater and Surface Water Advisory Board as a member representing Commissioner District Number 3. And the appointment is from June 1st, 2020 through June 1st, 2023.
Now that is number 10 on my agenda.
It is on mine as well.
So I have a confused agenda there, I apologize.
Okay, that's okay, that's all right. Any questions or comments regarding Mr. Netterhood? Okay, is there a motion?
I move to appoint Mr. Netterhood, Britt Netterhood, to the Storm and Surface Water Advisory Board as a member residing in Commissioner District 3 for the term of June 1st, 2020 to 1st, 2023.
Second.
Been moved and seconded to appoint Britt Netterhood to the Storm and Surface Water Advisory Board. Any further discussion? Okay, all in favor say aye.
Aye.
Aye, that motion carries. Number 11 is for Carla Sabata.
Yeah, also an appointment for your consideration to the Surface Water Advisory Board. And this will be for you to consider appointing Ms. Carla Sabota. And that will be for an at-large position in this board. And the appointment will be from June 1st, 2020 to June 1st, 2023.
Okay, any questions or comments? No. Well, is there a motion?
Move to appoint Carla Sabata to the Storm and Surface Water Advisory Board as an at-large member for the term of June 1st, 2020 to June 1st, 2023.
Second.
Been moved and seconded to appoint Carla Sabata to the Storm and Surface Water Advisory Board. Any further discussion? No. All in favor say aye.
Aye.
Aye, that motion carries. Number 12 is a reappointment to the Agriculture Advisory Committee.
Yeah, you also reviewed this appointment, commissioners, for your considerations to reappoint, is a reappointment of Mr. Kevin Jensen to the Agriculture Advisory Committee for the term of May 6, 2020 to May 6, 2022.
Any questions? Nope. Okay, is there a motion?
Move to approve the reappointment of Kevin Jensen to the Agriculture Advisory Committee for the term of May 6, 2020 to May 6, 2022.
Second.
Been moved and seconded to approve the reappointment of Kevin Jensen to the Agriculture Advisory Committee. All in favor say aye.
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 Aye, that motion carries. Number 13, appointment to the Hopkins Drainage Ditch District Number 2.
Yeah, you discussed this on a couple of occasions, this particular appointment again. And also you had a conversation last week with Mr. Thomas Thurston. And this is the Hopkins District 2, they have elected positions. And this position is position number 3, which the current member that was elected resigned, I believe, has been vacant for quite some time. And your appointment will be until the next election will take place, which is right now scheduled for February 20, 2022. And that's a little bit different of an appointment, but I believe you had a conversation with Mr. Thornton last week on that.
Okay, any questions or comments regarding this appointment? Nope. Okay, is there a motion?
Move to appoint Thomas Thorning to the Hopkins Drainage District 2, Position 3, for the term of March 9, 2020 to February of 2022.
Second.
Been moved and seconded to appoint to the Hopkins Drainage District Number 2. All in favor say aye.
Aye.
Aye. That motion carries. Number 14 is the voucher list. Were there any
For your
questions
consideration,
regarding that?
for your consideration is to approve the voucher list of May 18, 2020.
I move to approve the voucher list for the week of May 18, 2020 for a combined amount of $1,562,450.32.
Second.
It's been moved and approved, been moved and seconded to approve the voucher list for May 18th, 2020. Any questions or comments, polls? Nope. All in favor say aye.
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 Aye, that motion carries. And that takes care of that bit. And I just want to remind everybody, please, there's a virtual public hearing this afternoon at 3 p.m. That's June 2nd at 3 p.m. This is regarding the Critical Area Determinations Code Amendment, which is part of the Development Code, docket A16. There'll be a public hearing at 3 p.m. this afternoon. We'll be on Zoom, and you can conference call in as well. And your comments will be taken if you have any public testimony. That phone number, I'm going to give it to you real quick. The phone number is 360-252-9020, and your PIN is 1234. Thank you for that. And now we're...
And Commissioner, information as to how the public can join via the Zoom meeting is available online, where we have the notice for this public hearing. So I will encourage the public to get that information, how to join the Zoom meeting this afternoon.
Good, thank you, Romero. Now we're moving into commissioner items, and the first one is hazard pay.
I'd just like to bring this item to your attention. You have
How did you do that?
Yeah, that was funny.
Hang on, Romero. I think Robert's on. Are you on a futon?
Having technical difficulties all morning, and that was just one of them.
I have fallen and can't get up. All right, go ahead, Romero.
The last time you took an action in awarding 5% hazard pay was last month, and that lapsed in this Sunday, May 31st, 2020. And you awarded hazard pay to sheriff patrol deputies, correction officers, juvenile detention officers, as well as the security officers here at the courthouse, as well as some staff from the coroner's office. And I just want to make sure that this doesn't go by without giving you the option to take any particular action. My recommendation continues to be please don't continue awarding the hazard pay. As you know, we're moving into phase 2. The economy is open, and also my concern continues to be the impacts on the budget.
Can you let us know again what that 5% hazard pay equates to per month?
I think we have remind me, I think it's over 130,000 overall, not just a month, since you implemented this.
So I do have the.
You do have the amount?
I have the specific amount spent through the end of April was $80,126. And I can quickly bring up the amount for the first half of May. Was an additional 31, almost 32,000. So this is running roughly 63,000 a month.
Okay. All right, questions or comments from my seatmates?
Yes, I guess I'd like to comment that this money is gonna come out of our assistance money from the federal government, and I think it's money well spent in lieu of what these folks had to go through over the last few days involving the social unrest being demonstrated around the country. I think it's more than justified.
Commissioner Menser, anything to say?
Just continue to oppose it. For the budget impacts, we very narrowly avoided cutting people's pay or laying people off in our budget work session a week or so ago. I sit in on the WASAC webinars every week, multiple times per week, and I don't know that anyone's directly asked the question, but I have not heard of a single other county. We are always asking questions: what's covered, what's not covered, what are you guys doing, what are you guys doing? I haven't heard of a single other county that's doing this. So I just think that we need to be a little more conservative with our pay, mindful of people's jobs and what all the unknowns that we have coming our way with regard to budget impacts. So I'm hoping that we don't extend this.
And so from the get-go, I was supportive of this because of the nature of the beast of our uniform 24/7 day folks that are out there on the front line that don't have oftentimes the time to set an appointment and then glove up and mask up. They're jumping right into this. And especially in light of the Thurston County Sheriff's Office and our men and women on the road that are backing up our local law enforcement in the cities with riots, arson, assaultive behavior and such. That's what hazard pay is for, in my opinion. And I'm sorry it's come to that, very sorry that it's come to that. But they are out there protecting us. And to me, it's worth it, especially in fact, in light of the reimbursement that we will have for this piece of expenditure. And as well, I attend all the numerous WASAC briefings and listening sessions and discussions. And you're right, no other county is doing this. And I've had other counties and even cities suggest to me, "Hey, you're making us look bad. Don't do that." And my response was, "No, you're making you look bad. This is a value that I have to support the coroner and TCSO and juvie and such, and we're being reimbursed for that." So I'm very much in favor of keeping it going.
Okay, so what I'm hearing is 2-1, keep it go for how long?
Till we're done with this, as far as I'm concerned.
That was my
Well,
thought, but I don't know when we're gonna, do I do it
suggest for you to put a date and you can
Yeah.
revisit.
like a month at a time?
Well, I don't know, whatever you think is appropriate, but I strongly encourage the board not to have without an end date. That becomes
No,
extremely
I won't do it
difficult.
open-ended. It's gotta have an end date. And then we come back and revisit it, just like our weekly meetings. So I would propose that we go till the end of June, June 30.
I would propose that we go to September 1st.
Well, I know where Ty is. So I'm willing to look at it a month at a time.
I'm very sincere about going till September 1st. We're not gonna be out of this mess. We've got stupidity going on all around the country. I don't see it coming to a solution right away. And this COVID virus, this communist virus, if you will, is gonna continue for a long period of time, it looks like. And so I think we need to reassure those officers that we've got their back. We can cancel it anytime before that. If it gets to a situation where the governor now says, well, now we're back to normal. And until we're not back to normal, I want to continue this because these folks are in a combat zone on a regular daily activity. It's very much like Commissioner Hutchings said, they don't have time to suit up. When they get in a situation, they are running in and being exposed. We're asking an awful lot of them. I don't care if other jurisdictions are doing it or not, because I don't think they care about their law enforcement officers like we do.
Well, I agree that we don't know when it's gonna end. And I firmly believe they know that we have their back at this point. We've extended it several times. And yeah, we can go till the end of the year and rescind it if have to. But on the flip side, rather than extend it out and rescind it if need be, I'm in favor of us doing it 1 month at a time and keep it going that way. We can always add to it without having to go back and detract away. I'm fervent about doing it a month at a time, just to give us time to reassess as we move along.
I just want to go until the governor takes his order off of the public. That's when I want to call it. So when the problem is solved, then we can rescind it.
So the governor pulled the stay at home, stay healthy order is no longer in place. So now has established a phased approach. So the order, the stay home, stay healthy is no longer in place. So I don't know if Commissioner Minster, I understand where you're sitting on this, but I don't know if you'd like to break the vote in terms of the length of this action.
May I just, before you weigh in, Ty, the governor has rescinded that stay home, stay safe, and he's doing a phased approach. And I'm not in favor of any phased approach out of this 5% hazard pay and phasing it out. I'm in favor of not just waiting for the governor to decide what we do, but taking a stand and do it a month at a time. It doesn't remove it. It just gives us time to reassess as we go along and keep extending it if we need to. And I know TCSO knows where we stand on this. Commissioner Minster?
I'm not going to help you guys solve this problem. I mean, the discussion I've heard here is not even about the health pandemic. It's now about protests over police brutality in Minnesota. I mean, so obviously, this is just something that I think the other commissioners want to do because they want to do it. I don't really think it's branching far afield of even COVID-19 response, at least in terms of the discussion I've heard this morning. So not going to help you solve this problem. It's not good policy. I don't favor it for any length of time. So you guys figure it out.
Okay, and just based on what you just said, I see the nexus between, of course, the rioting, demonstrations and such, or protesting, and or anarchy. But in watching all the newsreels, downtown Olympia, many of those protesters aren't masked either, and so these folks are still, our employees are still very much exposed to COVID-19 exposure and other types of hazards. So I'm in favor of keeping it, but I just want to do a month at a time.
Well, looks like we're at a stalemate because I want to do it until this situation is done.
Okay, at this point, it's open-ended.
Okay, good enough for me, open-ended. It can go until we're out of this situation.
Or we rescind it.
That's right. Very good.
All right. Number 2, Thurston County Chamber's letter.
Yeah, Commissioners, last week you received a letter from the DOCMA, which is the Director of Public Policy of the Thurston County Chambers of Commerce. And this letter was addressed to Mayor Ryder, Mayor Komet, Mayor Selby, and you, Commissioner Hutchins. And so I'd like to bring this to your attention as a board. They suggested a couple of strategies, and it's really as to how, in this letter, is how the county can, or the jurisdictions can be part of relaunching the building construction sector in our local economies. They provided 3 main items. One is to defer and temporarily modify the time of payment of impact fees. The second is enable additive fees for after-hours review or expedited review. Third, enable third-party review or the outsourcing of work to adjust for staff furloughs. Item number 3, we don't have furloughs, so that may not be applicable. Item number 1, I believe we do have something in the code. The upon request for any particular developer who wants to defer the impact fees until the issuance of, I believe, the occupancy permit that is available. But also, Jenica is helping me with all this, and I believe she's already scheduled a meeting with the chambers to start exploring what is their additional feedback related to this proposal. Jenica, are you there?
Hello. Yes, so our recommendation from John and I was to set up a meeting with the Thurston County Chamber to discuss this at greater length.
So I'm not expecting you to take any actions at this point, Commissioners. I'd like to make sure, since this letter came to Commissioner Hutchins, is for the board to be aware of this request. Staff will reach out to the chambers, get additional information, and we'll report back as to what potential options you may have before you.
Romero, have you had a chance to talk with city managers about this?
Yes, briefly. Yeah, in each of the cities, they have similar options. Like the deferment of impact fees, I believe the 3 cities have in their codes the availability to implement that delay or that deferment upon request.
Okay. Commissioner Evers, I saw your hand up.
The county manager made some comment here on number 3 that we are not having staff furloughs, but we could at some point, you never know. But I think we could just fix that by adding or shortages of FTEs, because I do think we ought to go out to a third party. On the second bullet point, if you will, I don't think we ought to add additional fees for after hours or expedited review. I believe we're putting in place this video ability or photo ability for inspections, and I don't think we ought to add additional fees to our business community just to do business. So I don't think this goes far enough, to be honest with you. I think we need to get our economic engine going as soon as we can. We need to create jobs as soon as we can. There's a lot of people out there hurting, and I think everything that we can possibly do to alleviate that pain, we ought to be doing it. So the quicker the better.
Okay, Commissioner Menser?
I support a further conversation, and Jenica, just some feedback I got on the first point. I talked to somebody from Tumwater, and they were kind of confused because they said that the deferral of impact fees, which I think we have, what I understood is that we all have it by state requirement of state law for residential, but the proposal is to expand the deferral to other types of projects. And the person I spoke to in Tumwater said no developer ever uses the deferral for the residential projects. And so they were kind of scratching their head as to who thought that this was going to be a major, removal of a roadblock, and why. So I'm curious about that. When you're discussing this with the chamber, do they have information that this would really, that there's projects that would really take advantage of that? I don't really have any heartburn over it if it's something that would actually help, but I'm just not sure. Additive fees, I didn't really understand the second bullet point, so I'd like more clarity eventually on that one. And then the third one is something that we've discussed here amongst the board multiple times, and I understood from CPED that we do provide for this on a case-by-case basis, and as Ramiro points out, we don't have furloughs, so I'm not, that may be one that the other jurisdictions need to address, because I felt like Thurston County has already addressed that. But that was just my 3 cents on what I read in the letter.
Okay, well, there'll be more conversation on this as we get more information from the cities and from you, Jenica,
Sure.
and from Romero as well. All right, thank you.
Commissioner?
Yeah, go ahead.
I'd just like to comment, I'd like to eliminate as much bureaucratic delay as possible. I think we're getting a paycheck every 2 weeks, as are all government employees. There's citizens out there that are hurting. I want to expedite this, so whatever it takes to expedite this, working on weekends or whatever it takes.
We will bring back additional information after that conversation.
Good, thank you.
Thank you.
Number 3, flex unit, alternative option.
Yeah, and this is not, just to frame the issue, this item is not an attempt for you to sway any decisions that you already made related to the flex unit project. That is not. This is just a follow-up, at least from my understanding, on the conversation that you had over a month ago, where you stopped the development of the flex unit. And I believe the direction that you provided is to come back with some information to you as to how much it will cost to explore other alternatives. We're not here we're not prepared today to give you the other alternatives. We're here to provide you with information on how much it will cost to explore other options, as I believe you requested when you last discussed this item. So I have Chris Elmer online, as well as Robin. Chris has worked in some options. Without stealing his thunder, I'm gonna let him join in. And I don't know can you share your screen, Chris, or? Chris? Hey, Chris, can you hear me?
Yes, I can. Can you hear me?
Yes, can you share your screen? I believe you want to share your screen.
I do, and I will try. It's not allowing me to share the screen, Romero. It's telling me the host has disabled my screen sharing.
Okay, hold on, and I'll make you a host.
All right.
Okay, go ahead, and you should be able to share your screen.
Okay. Okay, can you see that?
No, I think you need to click that.
Okay, I have it up on my screen and I did hit share. Let me try it again. I don't want to waste too much time here.
Although you do have a copy of his PowerPoint presentation before you speak.
You can talk us through it.
I can talk you through it. I can certainly talk you through it.
We got it.
So what we did, based on the discussions we had related to this project before, we heard loud and clear that there were some alternatives that you guys wanted to take a look at. What I did was I gathered as much information as possible about the alternatives that had already been explored, and I dug pretty deep and worked with some AE firms that I have relationships with in the past. And I came up with some detailed estimates, which are not in front of you, but I do have them if you need them. Some detailed estimates about how much it would cost to do some project development studies. Now, these would include a fairly detailed scope of work for each of these and a fairly detailed cost estimate. I put those together in a real simple format for you guys so you just see the numbers. And then I also included the assumptions that I was using while I was going through these different options. And so that's what you guys have in front of you. Again, I have detailed estimates if you would like me to provide those. But this gives everyone an idea, I think, of what it would cost to do the studies that we would need to have justifiable and defensible cost estimates and scopes of work. So if we decided to move forward with any of these studies to really explore these and have good estimates, we could do that.
Chris, I have a question right up front on your assumptions.
Certainly.
And it says no COVID-19 functional revisions considered. Does that indicate or does that imply that we have COVID-19 functions within the current jail?
Well, the only thing that I was trying to accomplish by stating that was that we are not clear on any revisions that would be made to the functional characteristics of that organization. So I did not include those. I just wanted that to be clear. No, I'm not assuming that there are currently those kind of functions. I'm not insinuating anything. I just want to make sure that you guys understand I am not considering those in these estimates. But if we move forward with any of these project development studies and some of those types of functional revisions had been made, they would be included in that project development study, and those costs would be reflected.
So it seems to me, though, the functional revisions, one of them would be the number of beds. But I don't know what those functional revisions could be.
That may very well be true, and I don't know what the functional revisions would be either, but it probably would be beds. There would probably be other things related to the backstage functional operations with its staff. So there'd probably be revisions there as well. I just don't know what they are at this point.
Yeah, something quarantine and staff and yes, okay.
That's right.
And commissioners, my seatmates, any questions or comments, Chris?
Just for the public's benefit, and I know that we couldn't share the screen. So there's 4 options. The Chris worked, and again, these are the costs only to have a comprehensive, a good estimate as to how much one of those options will cost to implement. So the options before you is, as we understood, is a prefabricated portable facilities that can be built at the current jail. The cost for that option will be just about to develop, we estimate $69,000. The conversion of the work release building, the study will be about $93,000. Convert and build a new family justice center, the study will cost about $115,000. And refurbish the existing jail, the one here at the courthouse, the cost to do that, the study will be about $183,000. Behind your attachment is the detailed estimates Chris stated. And again, this is just a follow-up to the request for information that you had for staff at the last time you had this item before you. We're not requesting for you to take any action or provide direction at this point. Just following up on the request that you asked for staff.
I just would like to reiterate that the amounts that you just gave, Romero, for the prefab portable facilities, conversion of work release, convert and build a new family justice center, and refurbish existing jails, those amounts are just for the cost of the study.
That is correct.
That's it, just the cost of the study alone. Okay.
Because as you may recall, how this came about is in 2016, we developed a set of cost estimates for all the different options. And they were very high level estimates. We knew they were going to change. And you have participated in many briefings related to those estimates. So And at least from my understanding, at the last time you discussed, you would like to see how much it will cost to have a very comprehensive cost of all of the many different alternatives. So this is what it is.
Okay. Thank you. Commissioner Edwards?
I guess as we move forward on this very complicated problem, we've got a new issue, and that is this virus issue. So everything that we do, we're going to have to review how we do it with this new reality that we're dealing with. So whatever we do, I would like to see it build towards the CARE funding. I know one of the things that we had not anticipated was utilizing the old jail, but in the old jail, there would be adequate space to have separation if we used those individual cells to a maximum. And because of that, I would like to make sure that we at least review that possibility. We had no intention of doing that before. It was never part of our budget. So I believe it is eligible for the CARE funding, and I think we ought to look at whatever we need to do to revitalize that area and make it compliant with the restrictions of this virus issue. And kind of my follow-up would be to Robin, are we hearing anything? I know the military was looking at doing something there at some point in time. Is there anything afoot with that?
Yes, Commissioner, they have decided to, that their numbers are so low that it is not to their advantage to lease our facility, and they will instead just be buying bed nights from existing jails.
Okay, then I would propose that as we include the virus issue on all of these, that we bill that to the CARE funding, because we don't have enough resources to do it otherwise. And maybe that'll keep the litigation off our back, if you will. So just food for thought. That's kind of where I'm heading with this.
Is the CARES Act, is that funding too restrictive, or does this apply to that? So would this fit under those parameters?
Are you asking me that or Robin?
I'm asking Robin.
Oh, okay.
Personally, I do not believe that the studies of how to address our jail needs would meet the 5-question test for CRF money, and it is definitely not eligible for other types of money that the county is receiving in response to COVID.
Is there any chance you could read those 5 questions off to us and let us make that determination? Because I disagree with you.
Yeah, let me find them. It'll take me a moment to find them.
Well,
So.
yeah.
Okay.
While you're looking, Commissioner Menser, you have any comments?
I guess my question for my seatmates would be if there are any, well, the CARES funding issue might be critical to the answer, but my question is just, is there appetite amongst the 3 of us to look at any of these in this more in-depth way? I made it clear a month or so ago that I wasn't going to be willing to make any decisions for a while until I understood the full depth of our budget crisis, but I am willing to discuss the preparatory work that would be involved in some of these options potentially. I mean, I'm at least willing to have that conversation. So I guess that I'd like to hear what you guys have to say about that, or what the thought was about the next step, that we just look at this and go, oh wow, it's expensive to study these things and then move along, or is there going to come a point where the board is going to be asked or is going to ask itself whether we want to discuss these 4? I mean, you could do them all, or you could do one of them. I mean, back when we had the memo that wasn't sort of in depth and wasn't, it was still useful to sort of be able to compare and contrast, but this is a very expensive exercise to have 4 separate proposals for 2, 3, 4, 5, about $500,000 worth of studies, basically. So kind of seems like we'd have to have a discussion about the one or two we were most interested in, if we were going to, be interested in anything at all from this list.
When we discussed this last, as I recall, I had an appetite to continue with the flex unit and have the next step done. That wasn't going to cost us any more money, but have the next work done with the A&E person that firm that Chris talked us through with. And so my appetite is there only from the standpoint, or because of the lack of beds that we have, the increased risk to our corrections officer staff, and are not meeting the needs of our special needs folks that are incarcerated. So I was interested in not delaying it, but moving on with it. So I am still there now. And it's not so much, it's for those reasons, not so much of a pending lawsuit. And DRW made it clear that they weren't advocating for jail expansion. They were advocating, take care of the people that you have incarcerated. And this was one big step towards that. So you're right, there's a ton of money here for just the study alone, let alone the work, and not even costing operational costs as well. So it's still many things to be considered in this, but I have an appetite for doing something with the flex unit.
Is what you're saying that you would oppose these studies because you were comfortable with the flex unit plan as it was originally conceived? I mean, this may end up being Commissioner Edwards and I talking about, because I remember you wanted to move forward on the flex unit as originally designed. I think we outvoted you on that.
You did, you clearly did. And I would say that I'm not opposed to looking at some of these options. I am opposed, though, to refurbishing the existing jail, only from the standpoint in my head, and I'll hear it from Robin shortly. I don't think we're going to get money for that, free money. But also, it was, we looked at that refurbishing the jail downstairs several times, and it was absolutely cost prohibitive to even consider that an option. And I don't know what JBLM, I hear it's because, well, their numbers are low, they're going to rent bed space. But I think once they looked at it, they were okay. We were told they were happy with it. But it was going to cost them a chunk of dough to bring it up to standards as well. And I'm not looking forward to investing our money into that facility.
What soured me, oh, sorry, Robin. I just want to say what soured me on that one was the fact that the operational expenses of having the sheriff having to run two separate locations was going to just chow up any savings on capital expenditure. So that was why that one was not interesting to me either.
Yeah, and the sheriff didn't support it either. Mm-hmm. So go ahead, Robin.
I was just going to note that JBLM was not going to bring the space up to standards. They aren't held to the same standards, and they thought is just a very short-term solution while they build their new facility. Okay. So they had no interest, which is part of why it would have been cost-effective. They also plan to bring in all their own equipment. So all they were asking us to do was to clean the facility and ensure that the air quality and water quality were acceptable.
Well, we're busy cleaning this current facility.
Right.
So did you find the questions?
I did. So here are the 5 questions. You must say true to all 5 statements to be eligible for the Coronavirus Relief Fund, CRF, also referred to as the Treasury CARES Act funding. And they are the expenses connected to the COVID-19 emergency, the expenses necessary, the expenses not filling a shortfall in government revenues, the expenses not funded through another budget line item allotment or allocation as of March 27th, and the expense would not exist without COVID-19 or would be for a substantially different purpose. I think it's the number 5 that we would not meet for studying the jail expansion. space. This need exists without COVID-19. I will say, though, that if we were talking specifically about making changes to the old jail space to be able to use it as an isolation and quarantine facility for a limited number of inmates during this crisis, that those costs, I believe, would qualify for CRF money, but the purpose would be quite limited.
Yeah, and even number one, I question, because we've been talking about jail expansion long before we could spell COVID-19. So I can't just make that nexus. Oh, all of a sudden we need to do this. Commissioner Edwards, go ahead, sir.
Well, this community's been talking about jail issues for a lot of years, and I don't think any of it matters too much, except the portion that we wouldn't be talking about this, except for the COVID-19 issue. And that issue is going to be paramount with anything that we do. We have to take that into consideration. So if we need 10 times the footage, square footage, to house the same number of inmates, that's directly related. So I continue to disagree with Robin. I believe that the COVID money is usable in this area, and I think we ought to spend it here and do something and get some benefit out of it, rather than take a chance of missing an opportunity here to move forward with what would be a good solution, because I feel we're going to be dealing with a new reality from this point on, having to do with this virus business. So I think it behooves us to take advantage of this funding source at this point in time.
Did I understand you right, though? But you started off with, even though the jail's been talked about for a long, long time, we're talking about it now because of COVID?
We're talking about spacing because of COVID and the new way of doing business. I'll just give you an example. For tuberculosis, for an example, you have to design a cell that has negative pressure in it and goes to an outside exit. Well, probably that's what we're going to have to do with this virus business, something similar to that. You can't just recirculate the air through the system, or maybe if you could, you put a submarine filter system in. I don't have an answer. I'm saying all of these things that we look at. There's technology that through ultraviolet light in a facility, it can eliminate this virus. A lot of things can be researched that are directly related to this virus, and we are missing the boat for the taxpayers if we don't take advantage of every opportunity to do our job in a more efficient manner utilizing this money.
And operating within the standards that are set by the money givers.
Always, we have an answer of true to every one of these.
I disagree with that. Go ahead, let me get Robin and then Romero and then Tatai, okay? Robin, you have something to add?
Yes, as far as the CRF money goes, the other reason that this does not meet the criteria is we have until October 31st to have spent the money and received the goods or services. And this estimate states that it would take anywhere from 6 to 8 months for any one of these studies to be completed. So we would not have received that in time to claim the funds.
Okay, Romero?
So I'd just like to follow up on a comment Commissioner Edwards made. The county staff is planning to take advantage of this CARES money. And in fact, the board will be in the position to make some decisions as to how the money can be spent in a week or so. When you receive all the applications, you will receive a presentation this afternoon from the United Way as well as from the Thurston Strong, requesting assistance from this particular funding. We have past expenditures that we're going to be trying to get reimbursement. We're up to almost $3 million in response to this emergency. We're going to try to get reimbursed for the hazard pay and among other projects that perhaps you may consider funding. So I'd like to ensure the board that we are trying to maximize every single penny that has been given out of $15.7 million to the county. So if there's anything staff can do to facilitate the board's decision, is not to leave any money on the table related to this money.
Okay, Ty, you had something to say?
Ramiro just made the point I was gonna make.
Okay. Okay, well, this is good information, but we're not making a decision on this now, apparently.
Every once in a while, I'll bring this item again just to see if the board has any appetite to move forward in any particular option.
All right,
Not next week.
thank you for that.
If
Go ahead,
I,
Robin.
before we leave this item, part of the project on the Dale site is correction of a stormwater facility. And that needs to occur regardless of whether or not we build. So I guess the part of what I'm looking for is approval to move forward with the stormwater facility fix that needs to happen at that site, which kind of segues into the next item on your agenda today, which is the list of capital facility projects in central services.
We have 9 minutes. Is this doable in 9 minutes?
No. So we can do this another time.
I'm going to suggest that so we aren't rushed and we can take sufficient time with a ton of questions about this list and prioritizing and such if we need to, just to give it respect that it's due.
Thank you, Commissioner.
Oh, thank you, Robin. Ramiro, is there a public testimony?
No, sir.
Yeah, we just get a note here. Okay, so the CFP will come back to us then.
Yeah, I will schedule an upcoming meeting soon though, yeah.
Okay, and the commissioner items, I had one item and it was addressed right up front this morning at 9 o'clock with Dr. Yu, so that was that. We have just a couple minutes. Commissioner Menser, you have a commissioner item?
I do. I usually attend and report at the Rochester Chamber meeting. Last month, I talked about the CDBG and let them know that if there were ideas, they should forward them. And they did get together and create an email and send it on. I know I saw a copy of it. Tomorrow is the meeting. I'm assuming I'm going to be asked to report on where that stands. I haven't heard any. I know you, Commissioner Hutchings, you reported that there was a group that met and there was kind of a focus on food security, but I didn't know if there was a final decisions made or if the Rochester ideas, which were very, very small, modest proposals, I didn't know if any money was discussed or if there's anything that I should report back to them about where that stands.
Not at this point in time, no. It's still a work in progress.
Okay.
Commissioner Edwards, commissioner item? Burning topic?
Well, I guess my commissioner item at this point in time is we have gotten correspondence from the public reference our budget process. And I don't know, there's allegations that what we're doing isn't right. So do we have any upcoming comment about that by any chance later on? I mean, there's some, it sounds like some RCWs that were referred to that we can or cannot do certain things under these comments that the citizen brings forward. Are we gonna have any follow-up information on that?
We can certainly do. I believe the last correspondence was directed to the elected officials. Staff didn't receive, we just received a copy of that because it was not directed to staff, it was directed to elected officials, I believe. We can probably look into the allegations and maybe bring back to you some potential answers.
Okay, I guess my concern is that whatever we do it right. I don't wanna be in a situation that we're, I don't know, looks like we're putting elected officials in a pinch there by actions of ours, making them responsible for something personally, and I definitely don't wanna be in that situation, so I would like to have a review of this.
Okay. And that'll happen, I guess. I imagine it will. Just let us know, Romero. Thank you. Anything else, Romero?
No,
For the
sir.
board? And nothing else for the good of the order?
No, sir. You have a 1 o'clock presentation again by Thurston Strong in United Way.
Either way.
And they will make a request. I just received an email from Michael Cade for a formal letter of that request. So I will print this and I'll stick a copy, give it to you before the 1 o'clock meeting.
Good, thank you. And we have a 3 o'clock public hearing as well.
Yes,
So
sir.
this, what's that?
Yes, sir.
Okay, this meeting is adjourned. We're done. Thank you.